Hi, I'm Michael Demansky, Senior Physiotherapist at MD Health. What I'm going to talk to you today about is knee pain and the most common reasons for knee pain and what we would normally do about it here at the clinic. So the most common reason for knee pain is kneecap irritation or PFJ pain. It's sometimes a primary problem, and sometimes you can have some cartilage irritation, and as a secondary result of that, the muscles will stop working properly and allow the kneecap to drift out to the side. So what we're going to do is a couple of exercises here that we would normally do to address that problem. The first most common one is a lunge exercise on the reformer. We're going to do that right now. So standing on the reformer, 1 foot here, 1 foot up on the bar. I've got it at a reasonable weight because you need some degree of weight to do this properly. Body up straight, tummy muscles in, pushing the carriage forward. Now putting your weight through your heel and tightening the inside muscles of your thighs. That's the major stabilizer around the kneecap, and it drags the kneecap inwards. That stops the tight areas dragging the kneecap out to the side, which is where the problems occur. So body straight, tighten the inside muscle of your thigh, bending your knee down, knee doesn't go over your foot, come straight up and bring it back in. We're going to do about 3 or 4 of these just to show you exactly what we work on. So pushing the carriage out, knee goes over the second toe, tightening your thigh, bending your knee down, coming back up. Good. So same technique, and you go as far as you're able to and keep that control around the knee. So it's out, down, so my knee doesn't go over my foot, so it means I have to bend my back leg a lot more. Do 1 more of these. Good. So the other very important part is actually control around the hips. The muscles around the kneecaps are really important, but so are the muscles around the side of the hips. Because if these muscles aren't strong, it causes the knees to rotate inwards, and that effectively drags the kneecaps out to the side. So we're going to do an exercise for the muscles of the side of the hips that actually make sure that those muscles are working so that the kneecaps go straight. So 1 foot here, 1 foot I'm going to put on the side of the reform like this. Shoulders back, tummy in. I'm going to push the leg out to the side. That activates the muscle of the side of the hips. And then I'm going to bend your right knee. So down, come up, and bring it back in. And that asks the stabilizer of the hips to work at the same time as the kneecap muscles. Shoulders back, tummy in, out, knee over your second toe, down, up, back in. We'll do another 3 of these. Good. Again. And these are 2 variations of exercises we can use to work on the kneecap control. So that's the exercise we can do on the reformer. I'm going to show you 1 exercise we can do off the reformer, and then some other hands-on things that you can do for yourself at home to affect this problem as well. So 1 leg forward, 1 leg back. It's a lunge exercise just off the reformer. Again, weight through the heel, tightening the inside muscle of your thigh, which is the muscle that stabilizes around the kneecap. Bending down, knee doesn't go over your foot, and then coming straight back up again. Tightening your thigh the whole time, that's a really important part. So if you feel like you lose the control of those muscles working, that's as far as you go. So if I bend here and I can't maintain that tight contraction here in my thigh, I wouldn't go any deeper than that. Come back up, so down to there, and then back up. We'll do another 2 of these, and I'll show you 1 more thing you can do for yourself. Tightening your thighs, down, and back up. 2 more. Excellent. So I'm just going to sit on the bar here, and we're going to look at around the kneecap. So kneecap sits in the middle, it's dragged out to the side when the muscles here are tight, and when that happens, it rubs the lining of the joint, and that's where the pain comes from. The lining of the joint, called the synovial lining, gets rubbed in that surface, and that gets irritated. It's got a very rich nerve and blood supply, and that's what you feel. So what we're doing is strengthening the muscle on the inside of the thigh, which drags the kneecap towards the middle for the long term, but the muscles that are on the side here, particularly the fibers that come off this tight band called the ITV, tighten up as a protective response and drag it out to the side. So we're going to massage right here. We're going to hold it there. You can use one of the foam rollers, you can use one of the spiky balls that we have at the clinic, and otherwise you can use your fingers. You just put your fingers in that one too, hold it for about half a minute. It takes that long, and you'll feel it just go soft under your fingers. And it will change the sensation too. It might be quite uncomfortable. and then after a while it feels like nothing at all. So I don't feel it anymore. I'm going to bring my finger up a little bit higher. So you'll feel a tight bit, and you'll feel where it's sore, and that's where you hold it. And after you hold it for half a minute, it'll let go. That's it, it's starting to go. And that improves the control around the kneecap. So you can do that kind of stuff either before you start the exercises or afterwards. It doesn't matter that much. If you do have, quite acute pain around the knees, it's there present before you start. I would then do that first because that will then loosen it up so that it's easier to do the exercises. And if you do that after the exercise as well, so together they work really well. Thank you.